Guys, so let's discuss what is bipolar disorder, right? So this particular disorder, when we talk about, it was known as maniac depressive illness, right? Which is a mental health condition that causes extreme mood swings, right? So these mood swings include emotional highs like, let's say, mania or hypomania, and lows such as depression, right? Bipolar disorder is a lifelong condition and is categorized into several types, right? So each which is defined by the pattern of mood swings, right? So let's discuss the types of bipolar disorder. So the first one is bipolar 1 disorder, right? This type is characterized by maniac episodes that last at least 7 days, or by maniac symptoms that are so severe that immediate hospital care is needed. Usually, depressive episodes occur as well, typically lasting at least 2 weeks. Right? Episodes of depression with mixed features, let's say having depressive symptoms and maniac symptoms at the same time, are also possible, right? Now let's look at bipolar 2 disorder, right? So this type involves a pattern of depressive episodes and hypomaniac episodes which are less severe than maniac episodes and do not lead to hospitalization, right? But not the full-blown maniac episodes that are typical of bipolar 1 disorder. Right, now let's move to cyclothymic disorder, which is also called as cyclothymia, right? This is a milder form of bipolar disorder involving periods of hypomaniac symptoms as well as periods of depressive symptoms lasting for at least 2 years, 1 year in children and adolescents, right? However, the symptoms do not meet the diagnostic requirements for a hypomaniac episode and a depressive episode, right? Now let's look at the symptoms, right? So symptoms can vary, right? So it depends on, let's say, on whether the individual is experiencing a maniac or hypomaniac, or let's say a depressive episode, right? So it may vary. So let's first look at maniac or hypomaniac episode, what it includes, right? What are the symptoms, right? So there a person feels unusually high or euphoric or extremely irritable, right? There's decreased need for sleep. There is also, let's say, unusual talkativeness. There are these racing thoughts. There could be, let's say, distractibility. There could be, let's say, overconfidence in abilities or inflated self-esteem, right? That's also observed. There could be poor decision making, such as going on buying sprees, or taking sexual risks, or let's say making foolish investments. That also happens, right? Right, there could be, let's say, depressive episodes. It may include symptoms like feeling sad or hopeless, or let's say empty, right? There could also be loss of interest in almost all activities. That's also seen, right? There could be significant weight loss or gain, or let's say there could be increase or decrease in appetite. That's also seen, right? You can see insomnia or sleeping too much. That's also a symptom, right? Restlessness or slowed behavior, that's also kind of seen, right? There could be fatigue or loss of energy. There could be, let's say, feelings of worthlessness or excessive or inappropriate guilt. That's also seen, right? You can also see decreased inability to think or concentrate, or indecisiveness, right? That's there, right? There could be thoughts of death or suicide, or even suicide attempts as well, guys. Now let's look at the causes, right? So what are the causes? So the exact cause of bipolar disorder is not known, but let's say a combination of genetics, environmental, or let's say altered brain structure can play a role here, right? Now let's look at the first aspect, which is genetic predisposition, right? So bipolar disorder is more common in individuals who have a family member with the condition, right? So neurotransmitters could be another thing, wherein an imbalance in the brain's signaling chemicals may contribute to this particular condition, right? There could be environmental factors as well, which can be, let's say, stress, trauma, and significant life changes. they also can contribute to the onset or progression of bipolar disorder. Now let's look at the risk factors for this particular disorder, right? So what are these? So the first, so actually I can say that researchers are studying possible causes of bipolar disorder. Most agree that there are many factors that are likely to contribute to a person's chance of having the disorder, right? The first one could be, let's say, brain structure and functioning. So some studies show that the brains of people with bipolar disorder differ in certain ways from the brains of people who do not have bipolar disorder, right? Or any other mental disorder. So learning more about these brain differences may help scientists understand bipolar disorder and determine which treatments will work best, right? At this time, healthcare providers base the diagnosis and treatment plan on a person's symptoms and history rather than, let's say, brain imaging or other diagnostic tests. Right? Now let's look at the second cause, which could be genetics, right? Some research suggests that people with certain genes are more likely to develop bipolar disorder, right? Research also shows that people who have a parent or sibling with bipolar disorder have an increased chance of having the disorder themselves, right? Many genes are involved and no one gene causes the disorder, right? Learning more about how genes play a role in bipolar disorder may help researchers develop new treatments, right? So yes, now let's look at diagnosis. Right, so diagnosing bipolar disorder can be complex and requires a careful and comprehensive evaluation by a mental health care professional, right? Diagnosis is usually based on various factors, right? So the first one could be, let's say, the individual's history of symptoms. There could also be, let's say, the individual's family history of mood disorders, right? That also plays a role, right? There could be, let's say, a thorough psychiatric assessment. That's also kind of required. They might also need a medical history and physical examination also, right? Sometimes mood episodes can be associated with other medical conditions or substance abuse. So it's important to rule out these other causes as well. Now let's move to the treatment aspects, right? While bipolar disorder is a lifelong condition, effective treatment can lead to better control of mood swings and related symptoms, right? So treatment usually includes, let's say, a combination of medications and psychotherapy, right? So let's look at the first aspect, which is medications, right? So medications may include mood stabilizers. There could be antipsychotics and antidepressants, right? It's often a process of trial and error to find the right medication and dosage, right? Now let's move to the second aspect, which is psychotherapy, right? So counseling can provide support, education and guidance to individuals with bipolar disorder and their families, right? So yes, now there could be lifestyle management as well, right? So regular sleep patterns, or let's say exercise and diet, play a role in stabilizing mood swings, right? So one must follow that as well. So basically, I can say that living with bipolar disorder can be challenging, but with the right treatment plan, individuals can manage their symptoms and they can lead a very fulfilling life, right? It's crucial for individuals with bipolar disorder to work closely with their mental health care provider and adhere to their treatment plan. So that's very important, right? So guys, I'm really hopeful that you guys like this video, and more videos are going to come along your way on mental health topics. Thanks for staying tuned, and thank you so much, guys. Do subscribe to my channel.